and welcome again to AMJ's Public Policy Update 2.0. Again, my name is Chet Spee, Chief Policy Officer of AMGA, and I'm with...
Hi, I'm Daryl Drevna, Senior Director of Regulatory Affairs at AMGA.
So in our first video, we talked about the Medicare conversion factor and some of the changes to evaluation management codes and the impact they'd have on our members. Right now, we're going to talk about an issue that's near and dear to everyone's heart, particularly yours.
Yes.
The MIPS value pathways that was discussed in the comment that we sent to CMS yesterday.
Right.
Daryl, let's talk about that.
Sure. So MIPS is something that CMS has been trying to implement for the past couple of years, and they're proposing some fairly significant changes to how quality reporting will work under the program. And in our comment letter yesterday, we were fairly critical of what CMS is proposing.
And why is that?
So we oppose this in our comment letter for a few reasons. One, I think this will undermine care coordination. What CMS is attempting to do under the guise of burden reduction and administrative simplification, which we would normally support, is they're bundling quality measures and improvement activities around a specific specialty or an episode of care. Okay. And while on paper that might make sense, we're concerned that if each specialty is going to implement, develop, and report around its own MVP, you're going to start seeing siloing of care and breaking down of care coordination because everyone's going to be focused on their little slice of what's going on in the quality reporting realm.
Yeah, and given the fact that our members are multi-specialty, we touched on this in our first video, and
Right.
the sort of discrete silos of care is not how our members operate, and there is a lack of care coordination, I think unintentionally, through the MVP program, and that's why we took that stand.
That's correct. And one of the other things that we hit on is they're proposing to sunset the traditional MIPS program in the out years, 2028. You'll have to use one of these MVPs. It's optional for a few years rolling it up, so that's good. It's still voluntary. But I think CMS is what they're doing here, and I hit on this in our comment letter, is they're worried about reforming the program and sort of changing some of the window dressing and that sort of stuff, but they're ignoring the crack in the foundation. And that's the low volume threshold and the exclusion of so many providers from the MIPS program. And when you do that, you get a situation where these negligible payment updates. So you've really got to hit the top level performance to get even a remotely meaningful payment adjustment. So rather than focus on how quality measures are being submitted into the program, I think CMS would be better served, our members and their patients would be better served by fully implementing the MIPS program.
Right, so MIPS was designed to be an incentive program to value, but what really happened, because it excluded so many people, the rewards weren't there.
It's not there.
All the work that our members put into the MIPS program.
Exactly right. It's essentially devolved into a regulatory compliance exercise. And as a reg guy, like, oh, that's great, comply with the regs, but that's not what our members want to hear. Yeah, no one else is. Yeah,
no, totally understand.
Yeah.
Okay, well, that is our view on the MIPS value pathways. We don't like it, and I think at the end of the day, what CMS really should do is focus on incentivizing value and cutting down the regulatory burden. Next time, I hope they will do that.
We'll keep working at it.
Okay, all right, thank you.